Pola Office is a simple-to-use in-office tooth whitening system requiring minimal chair time. Whiter teeth are achieved in just 30 minutes. This video demonstrates and provides information which will assist you in preparing the patient for the Pola Office whitening procedure. Before starting treatment, carefully review the patient's medical and dental history. Thoroughly discuss the benefits, risks, advantages, disadvantages, and the perceived final outcome of each treatment option that is available. To assist you, a treatment checklist and informed patient consent form is available for download on the SDI website, www.sdi.com.au. Go to the Tooth Whitening Pola Office tab in the Products menu for this information. If the patient has a history of sensitivity, you may want to prescribe a desensitizer such as SDI Soothe for half an hour prior to beginning the whitening procedure. Prior to starting the procedure, please ensure you, your staff and the patient are wearing appropriate protective eyewear, gloves and masks. Review and explain the whitening procedure and be certain it is understood by the patient. With the patient, determine and record the pre-whitening shade of the teeth using a Vita shade guide in order of brightness as opposed to the standard arrangement. We recommend at this stage a before photo be taken. This will provide a starting shade reference to be compared to the post-operative shade. Assemble all of the material you will need for the whitening procedure, including Vita shade guide, patient mirror, air water syringe tip, cotton rolls, cheek retractor, petroleum gel, Profi cup and flour-based pumice, saliva ejector, Pola Office kit, timer, high-speed evacuator, vitamin E or slurry of sodium bicarbonate. Clean the teeth with a Profi cup using a flour-based pumice that is free of glycerine and fluoride. Your goal is to remove plaque and debris from the teeth to allow the whitening material to stay in close contact with the tooth. Thoroughly rinse the teeth to remove all the pumice. Place cheek retractors and cover exposed lip surface with petroleum gel. Be certain as much of the lips as possible are retracted by the cheek retractor. Cotton rolls may aid in protecting the lips from coming in contact with the whitening material. Dry the teeth and gingiva using your air water syringe. Once dry, slowly apply gingival barrier to both arches. Overlap the enamel and interproximal spaces by about ½ millimeter, paying extra attention to interproximal spaces. After this first application, apply another level of the gingival barrier until it extends about 3 millimeters on the gingiva. Light cure the gingival barrier in a fanning motion for about 10 seconds until cured. Use an explorer or other instrument to be certain all areas are cured. Once mixed, Pola Office gel is effective for 20 minutes. Therefore, it is important that the liquid and powder are mixed just prior to being applied to the teeth, away from the patient. Have a timer ready. Open the powder pot. Take one Pola Office syringe and firmly attach a tip. Carefully pull back the syringe plunger to release pressure. Carefully extrude the contents of the syringe into the pot. Immediately mix using the brush applicator until the gel is homogeneous and bright blue in color. Apply a thick layer of gel, about 2 to 3 millimeters thick, onto all teeth undergoing treatment. Set the timer for 8 minutes. If the gel comes into contact with soft tissue, vitamin E or a slurry of sodium bicarbonate can be applied to relieve the irritation. This relief will be immediate, and you may continue the whitening procedure if the patient is comfortable. At this stage, a curing light can be used to speed up the reaction, such as the SDI Radii Plus with the bleach attachment. Alternative bleaching lights may also be used. Please note, the end result will be the same with or without the use of a bleaching light. However, the treatment time may be shortened when using one. After this time, suction off the gel with a high-speed evacuator. Do not rinse the gel from the teeth. If the desired tooth shade is not achieved after one application, Pola Office may be applied up to 4 times in one session. You may use the same pot for the first and second applications. A second pot of freshly mixed gel is required to complete the third and fourth applications. After the last application, suction off the remaining gel and use your air-water syringe to rinse the teeth. Use your high-speed evacuator to suction as you are rinsing. Make sure the whitening material does not enter the oral cavity. Together with the patient, record the post-operative shade and compare it to the pre-operative shade. After only 2 applications, the teeth of this patient lighten from A3 to B1 shade. Remove the gingival barrier by lifting it from one end using an explorer or other instrument. We recommend at this stage an after photo be taken. Discuss the outcome with the patient and the recommended next steps. It is important that you discuss with your patient the post-whitening care procedure, which can be found on the SDI website www.sdi.com.au and is located under the Tooth Whitening Pola Office tab in the Products menu. You may choose to dispense a desensitizing gel such as Soothe to minimize any post-whitening sensitivity. To further enhance the brightness of the smile, a maintenance program is highly recommended using one of SDI's take-home tooth whitening systems, such as Pola Night, a carbamide peroxide-based home tooth whitening gel, or Pola Day, a hydrogen peroxide-based home tooth whitening gel. These systems are utilised with custom whitening trays which are placed in the patient's mouth for a period of time, depending on the type and concentration of the gel. Pola Night is available in 10, 16 and 22% carbamide peroxide gel. Pola Day is available in 3, 7.5 and 9.5% hydrogen peroxide gel. Pola Paint is a paint-on tooth whitening system that patients can carry in their handbag or top pocket. It is recommended to touch up the teeth as the desired shade starts to change. A range of marketing materials, including posters, patient information leaflets and waiting room videos designed to assist your dental office to successfully promote tooth whitening, can be obtained from any SDI office or by contacting your local dealer representative. Thank you for taking the time to watch this demonstration. If you would like to find out more about Pola Office or any other SDI product, please visit our website www.sdi.com.au or contact our offices by phone.